Well, let's take you back to developments coming out of KwaZulu-Natal, and we should focus and take a look at healthcare facilities. Several of them in that province have been affected by flooding that has left almost 400 people dead and thousands homeless. We speak now to Dr. Sandile Tshabalala, head of the health department in KwaZulu-Natal. Thank you very much, sir, for availing yourself this afternoon. As we understand it, some 58 healthcare facilities have been impacted. Is this number still the same? Has anything changed, and where exactly?
Good afternoon to yourself and good afternoon to the viewers of your program. The number, yes, it's 58, but we keep on assessing the different facilities of our province to see how far they were impacted. What we are assessing is the functionality of these facilities. As we speak today, one visited at least 3 facilities, and you could see that there was flooding that happened, but the facilities are functional, at least 2 of them. One of them, you can see that we still need to do a lot of cleanup before it can be functional. So the numbers will fluctuate depending on the findings and the advice from the infection and prevention and control managers in some instances, but also informed by the workload of how much we are cleaning them and making them easy to work in. So we are doing that. So far, the number you are quoting is correct.
You mentioned that you visited 3 facilities which are functional. From what you saw, the number of people that walked in through the doors that needed help, what more did you witness where that is concerned, and are hospitals coping?
The numbers of people walking in, maybe we should start by really thanking our staff and encouraging them to continue doing the good work they are doing. You remember that our staff and the community accessing our facilities has been affected by the availability of transport, by the roads that have been affected negatively. So some of our staff were either unable to reach the places of work, just like our clients. Some of our staff have been unable to go out of our facilities, just like also some of our clients. So the workload, the head count in terms of our outpatients departments in particular has not been as high as it normally is. However, we do have contingency plans of how do we manage patients that need to come to us, patients that need to be admitted and operated, patients that need to be transferred. So we are doing everything possible. We are worried, though, about the patients who are unable to go to our CCMGD sites and other sites where they get to pick up their chronic medicines, because that will have a future negative impact on our clients. But also equally worried about the patients who are maybe now starting to use water that is not as clean because the water has been cut off for one reason or another. And we have always been encouraging them that at least let them boil this water before they use it, try to make it cleaner water before they can use it, and all that advice is ongoing. But the assistance from all the levels of government, I think, is going to resolve most of these problems as soon as possible.
Dr. Tshabalala, you speak of contingency plans and you speak of some of the patients not being able to access chronic medication that they desperately need. Are you able to outline what those plans are?
Let me make an example. There would be patients who would come to our OPD and have minor illnesses that they can be discharged without really being admitted in our hospitals. Such patients we do release with ease. There will be patients who are already in our facilities, but are probably patients that can do with being at home and not be negatively affected in terms of the quality of care, the future impact as well. We do release such patients. But also where patients need to be operated, and in that facility there is a challenge in terms of our staff being able to access the facility. We have, particularly in eThekwini, because we've seen that happening, we have been able to say patients will be transported from one facility to another, and operation is done there. Our objective is to say, let the quality of our work not be compromised, even if the conditions or environment under which we are working is a little bit compromised in itself. So those are the plans that we're having. But on a daily basis, we assess how we are doing, and assisted by the government of KwaZulu-Natal in particular, the national government and the municipalities, coordinated by the Office of the Premier, who are doing everything possible, particularly in supplying those things that are not under the Department of Health's control, like water in some of the institutions. We have had water being cut off, but we can assure you it does get to be supplied one way or another so that the work continues in those facilities.
Just very quickly for us, in your assessments, how worried about waterborne diseases or diarrhea diseases are you in the face of these floods?
We are very much worried. That is why when we started to communicate with the communities, we, among other important things we mentioned, was that they be careful of the water they are using, whether for washing themselves or washing their clothes or for drinking. They need to clean that water. They need to boil that water. They need to also put all the other advices that have been used before in terms of cleaning water, and we are worried about that, and we are vigilantly looking at such incidences coming in. Remember, some people may end up with some allergic skin diseases because of the water they are using, and also others may end up having a recurrence of their diseases because they've not had their medicine. So we are also planning forward to make sure that we do not have another disaster out of this disaster we faced as a province.
Indeed, Dr. Sandile Tshabalala is the head of the health department in KwaZulu-Natal. Thank you for those details.